Dr. Layla MARZOOQI, specialist cardiologist in King's College Hospital, London in Dubai. A lot of patients that they have heart problem, they come to see me in the clinic, and one question they usually ask me is, "Doctor, can I fast?" Well, what I tell them and tell the public that people who have heart disease, they should always consult their doctor before deciding whether they can fast or not. People who are having heart problems, some of them they can fast and some of them they cannot fast, depending on their case and depending on the disease which they have. A study has shown that people who have stable heart disease, they are able to fast and they have got positive effect on their health, because putting into consideration the risk factor for cardiovascular disease, which is high blood pressure, diabetes and high cholesterol level, obesity and a stress level, all of these 5 factors that I've mentioned, fasting can tackle them and can reduce the blood pressure, reduce the level of bad cholesterol according to studies, and reduce the anxiety level in people who are having heart disease and they are fit to fast. So I do encourage people to go back to their doctor to ask them about whether they can fast or not, and to not to indulge with and shock their system with food during iftar time. A lot of people have asked me previously, what should I do if I have a chest pain? Chest pain is kind of like a very broad symptom that we see so many people coming into the clinic with these symptoms. It has got so many causes, but I always recommend people not to ignore any chest pain that they may have, especially if this chest pain it associated with other symptoms like dizziness and shortness of breath, and especially if they have a family history of heart disease or they're suffering from high blood pressure or they are diabetic. I always say if you have a chest pain, go and see your cardiologist, and he or she will look after you in terms of doing the taking the proper history, doing the appropriate examination and the test which is required to tell you the reason for your chest pain. I always recommend people who are already suffering of heart disease, especially angina or had heart attack in the past, and if they're having chest pain, I recommend them taking the tablet under the tongue or the spray under the tongue. They take it for 2 to 3 times, 5 minutes apart. If the pain didn't go away, always to call the ambulance and present to emergency room. And I all recommend not to drive the car to emergency room, because the time that takes the patient to come from home to the hospital is very vital in terms of the outcome of the disease. Did you know that heart disease is #1 killer in women? A lot of women, they don't know this information and they think heart disease is a disease for men only. Unfortunately, there are a lot of women dying each year worldwide from heart disease. Unfortunately, as well, that women don't present with the same signs and symptoms that for heart disease like their counterpart men. Men usually they present with heaviness in the chest or chest pain that goes to their neck and their arm. But in women, the symptoms are non-specific and kind of like a very general symptoms. These symptoms include nausea, vomiting, dizziness, shortness of breath. I will suggest any woman who has these symptoms which I have mentioned previously to come forward and see us in King's College Hospital, London in Dubai, and benefit from Women's Heart Health Program.